BISICLAs, rheumatic heart disease. Rheumatic heart disease is a cardiovascular condition that arises as a result of rheumatic fever. Rheumatic fever is a systemic inflammatory disease of connective tissues caused by group A streptococcal bacteria. Therefore, rheumatic heart disease is a complication of rheumatic fever which presents with frequent inflammation of heart valves, which may end up into permanent damage to the valves. The main valves that are affected by this condition are the aortic and the mitral valves. So, this condition comes as a result of poorly managed streptococcal group A upper respiratory tract infection. So, when group A streptococcal bacteria gets an access into the blood circulation, it will cause inflammation of connective tissues such as tendons of joints, ligaments of joints, digestive tract sphincters, and more so the heart valves. So it will attack the heart valves and causes inflammation. Repetitive attack of the valves will end up into scarring of these valves and later on develop into stenosis or narrowing of these valves and incapability to carry out their function of preventing the black flow of blood. Signs and symptoms or clinical presentation of rheumatic heart disease. Number 1 is the sudden onset of fevers. Sudden onset of fevers as a result of hotness and pain around the joints is a cardinal sign of rheumatic fever. Number 2 is arrhythmia. Arrhythmia is irregular heartbeat or irregular heart rhythm that is associated with heart murmurs or extra soundings. Number 3 is palpitations. This is abnormally rapid heartbeat that is even felt at normal body activity. Number 4 is painful joints. Pain around the joints, especially the knees, ankles, hips, and elbows, is also a cardinal sign of rheumatic fever. Number 5 is cough associated with hemoptysis. If a patient experiences productive cough but there is blood in the sputum, this also implies or may also be a sign of rheumatic fever. Another one is swollen and tender joints. Swelling of joints and pain on touch around the joints is also showing rheumatic heart disease. Another one is hyperpyrexia. Abnormally very high body temperatures beyond 37.5 degrees Celsius. Another one are symptoms of congestive cardiac failure, eager chest pain, shortness of breath, tachycardia, and others. Another one is weight loss and other minimal signs like nausea and vomiting, loss of appetite, and others. All those ones are signs of rheumatic heart disease. Predisposing factors to rheumatic heart disease. Number 1 is repeated and treated streptococcal group A infections, especially the upper respiratory tract infections caused by group A streptococcal, ig, sore throat, tonsillitis, sinusitis, and others that are caused by streptococcal group A. When these are poorly managed or poorly treated, can put someone at a risk of rheumatic fever. Another one is autoimmune response. Autoimmune response disease, where the immune system attacks the cells of the valves of the heart, is also a predisposing factor. Then genetic factor. Rheumatic heart disease, there are some chances that it can be inherited from the parents to the offsprings. Then poor streptococcal antibiotic drug compliance. If someone gets an infection caused by streptococcal group A and given antibiotics, then the drug compliance is poor, that person is at a high risk of rheumatic heart disease. Another one is children aged of 5 to 15 years. These are at a high risk because they are so much susceptible to upper respiratory tract infections such as tonsillitis, sore throat, rhinitis, and others. So these infections can descend downwards and result into rheumatic heart disease. Another one is overcrowdedness. Overcrowded areas predispose someone to upper respiratory tract infections such as rhinitis, those tonsillitis, and others, sore throat, and others. So in the end, someone may get rheumatic heart disease. Another one is poor hygiene, especially hand washing. If someone touches on the surfaces that contains streptococcal group A bacteria, then this person fails to wash the hands properly, then touches into the eyes, nose, and other body openings. This may give access to this bacteria to enter into the body and causes rheumatic heart disease. Management of rheumatic heart disease. Rheumatic heart disease, in severe cases, it is a medical emergency which needs quick interventions. We start with admission. The patient is admitted at the medical ward in a quiet and well-ventilated room. Position. The patient is put in a sitting up position in cases of dyspnea to relieve difficulty in breathing. Oxygen administration. Administer prescribed amount of oxygen to aid in breathing. Then administration of prescribed drugs, especially penicillin V, which is a drug of choice for rheumatic heart disease. Then anti-inflammatories such as hydrocortisone 200 milligrams start and prednisolone to counteract the effect of inflammation of the valves. Then monitor vitals, monitoring blood pressure and pulse rate plus respiration to rule out congestive cardiac failure. Then history taking and assessment, both objective and subjective data is taken from the patient, such as the biodata and the history of the disease and the drugs that the patient has been using. Then physical examination examine the patient for signs of edema, which may be a sign of congestive cardiac failure. Signs of edema, signs of dehydration, the signs of lymphadenopathy or inflammation of the lymph nodes. Then give a complete bed rest. The patient is given a complete bed rest to avoid high or increasing the metabolic rate, which may also increase the temperature. Yet we saw that in one of the signs is hyperpyrexia and sudden onset of fevers. Then tepid sponging may be done. Tepid sponging to relieve the fevers and hyperpyrexia is also performed. Then application of cold compress around the joints, around the swollen joints, to relieve swelling and hotness. Then painful joints may be supported or are supported by a smaller pillow to relieve the pain and promote comfort to the patient. Then gentle handling of patient's joints to prevent worsening of the pain. Then fluid balance chart is also monitored. This means that we may need catheterization to aid in draining our urine to ensure proper monitoring of the input and output of fluids in the patient. Then if there is signs of heart failure, treat heart failure with digoxin. Then about the diet, we give the patient light, nutritious and easily digestible foods with plenty of fluids with low salt. This is done, but in case the patient is having congestive cardiac failure, then we restrict on the fluid intake. But if there is no congestive cardiac failure, the patient in the diet, plenty of fluids are also involved. Then in the diet, still proteins are also crucial to aid in repairing of the damaged tissues. Then also carbohydrates are important and vitamins. Then that is simply the management of or that is the specific management of rheumatic heart disease, which is in form of an emergency. Then complications of rheumatic heart disease. Rheumatic heart disease may result into congestive cardiac failure, as we saw. This comes as a result of aortic and mitral valve stenosis. Another complication is stroke, ischemic stroke, due to or which will cause diminished oxygen supply to the brain. Then chronic rheumatic heart disease. So acute attacks of rheumatic heart disease may result into a chronic condition of rheumatic heart disease. Then endocarditis or heart inflammatory diseases such as endocarditis, myocarditis, pericarditis, as a result of hypersensitivity to streptococcal group A bacteria. Then another complication is impaired movement due to joint damage or joint nerve damage. Another one is ruptured heart valves. This comes as a result of frequent or repetitive inflammation that can later develop into damage or rupture of the heart valves. Simply, that is rheumatic heart disease in medicine 1. If you have any question, just go in the comment box and ask a question. I will be answering you. Don't forget to subscribe and ring the bell to get the notifications of more simplified and interesting videos like this. Thank you so much.